Welcome to the Office Hours Quality Payment Program conference call. My name is Jenny and I'll be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. During the question-and-answer session, if you have a question, please press star then 1 on your touch-tone phone. I will now turn the call over to Mona Matthews. You may begin.
Hello, everyone. This is Mona Matthews. I am a project specialist with Lake Superior Quality Innovation Network, and we serve Minnesota, Michigan, and Wisconsin under the Centers for Medicare, Medicaid Quality Improvement Organization program. I would like to welcome you to the QPP office hours. Today's call will be assisted as you heard. And just as a reminder, everyone's phones are currently muted to avoid background noise. Since this is an open office hour call, there will be opportunities to ask questions over the phone, at which time our operator will provide instructions. We will also closely monitor the chat box and encourage you to post questions or comments throughout. And remember, that's in the chat box. We need you to put that in. Also, please note that the information provided during this session is based on the latest information made available by the Centers for Medicare and Medicaid Services, or CMS, and is subject to change. CMS policies change, so we encourage you to review specific statutes and regulations that may apply to you for interpretation and updates. At the end of this office hours, you will have an opportunity to complete a brief evaluation. We would appreciate your feedback about this event and suggestions for future educational opportunities. We'd also like to remind those of you that received direct technical assistance related to the Quality Payment Program to please take the time to complete the evaluation sent at the conclusion of each technical assistance encounter. Your feedback is valuable, and as always, it allows us to gauge how we are doing in regards to the meeting your information needs in a timely and courteous manner. Let's see.
Mona?
Okay. Yeah.
Weren't we to ask Holly to press star 1, was it?
Yeah, Polly, if you could, I know you're in the main room, if you press star 1, they can elevate you to a panelist.
From an audio perspective, so.
And I'd also like to just mention that during the office hours calls, we typically can address a broad range of questions which are based on the equally broad range of QPP NIST knowledge level of our call participants. Some questions we will be able to answer very quickly. Others may require some additional time and research due to the complexity of the question. While other scenarios specific to your organization, we may need to follow up with you. Our team is implementing a new process to capture all the Q&A presented during these calls. Questions that our team deems broad and applicable to all in our audience will be emailed to all participants within 2 weeks of this event. Those that are scenario specific, our team will address directly with the attendee via email or by phone. Finally, questions that require more research or those that appear frequently will be addressed at the next office hours. With that, I'm going to just turn things over to Candy, or have Candy walk us through a few slides that we've put together. Her and I will tag team this. Go ahead, Candy.
Sure. Hi. Thanks, Mona. Hi, everybody. Welcome. This is Candy Hansen with Stratus Health. I also have Reed, Hazy, and Lisa Gall from the Minnesota team. We've got, as Mona mentioned, a great team on the line, so hopefully we'll be able to answer most of your questions as we go through. Because we are in 2018 and things are moving in terms of data submission, we felt that it might be helpful to just take a few slides and cover some of the data submission basics. We'll just go ahead and run through those, and then we'll open it up certainly for questions after that, and then the lines will be open again. So next slide. Mona's already covered the disclaimer, so we're good to go with that. She's also covered that we are the Lake Superior Quality Innovation Network. So we're MPro, Stratus Health, and Metastar. And here, let's get started with our submission basics then. So starting January 22nd, 2018, the QPP website opened, and it is there's a link to it. For CMS web interface reporting, that data submission period is slightly fewer days than it is for all of the other data submission methods. The web interface begins, quality reporting and data submission begins January 22nd, 2018. When you go to the QPP resource page, you'll notice on the top right-hand corner now, there is a login button for data submission.
And I think it's worth adding to the dates here that the submission period, we've got it up here, it goes through March 31st, but that web interface has goes through the 16th of March if you're reporting via that mechanism, which is here.
Yep.
I was getting a little bit ahead of it. Sorry, stole a little candy thunder there.
Oh, no worries, Reed. So so the reporting deadline for all methods except CMS web interface is March 31st, 2018. The CMS web interface closes March 16th, and it actually closes March 16th at 8 p.m. Eastern Standard Time. So just something to keep in mind so that you're not cutting your time so short that, that becomes an anxiety producer for you. If you're in an alternative payment model, you should work with your alternative payment model entity to discuss any data submission special considerations that you have.
And maybe I could just add one word to that, Candy. So she mentioned that on the qpp.cms.gov homepage, that's where you navigate. Simply go to the upper right-hand corner of the screen, and you'll see in big, bold, blue letters, sign in, submit, and manage data, and that will be the way you get access to that portal.
Yep, absolutely. We're just going to do a couple of slides about the EIDM account, the basics. Your EIDM account, which is your Enterprise Identity Data Management Basics, that is the way that you have access to the CMS portal to be able to actually do data submission. And we're just bringing this up because we were acknowledging that, from the old meaningful use days and PQRS days, this looks quite different this year. So you do need to, if you had an EIDM account, your account should be the same for the previous legacy programs. Again, you visit that CMS portal to set up, get account information, and reset your password. You'll need to assign the necessary EIDM accounts and roles. And then we just put a couple of URLs there for EIDM guides. You can either go to the guide, or you can email the CMS help desk as opposed to calling them. Although I had a person yesterday who said, "Hey, I've been trying to get a hold of CMS to get my roles figured out, and I emailed them a few days ago, and I haven't heard back. What should I do?" And I just said, they're probably inundated right now with people just realizing they have to get into their EIDM account and verify their roles and so on. So I said, you're probably going to be spending wait time on the phone, but I guess I would just call and just wait it out so that you can get your questions answered. We are here. Go ahead.
This is Mona, and I would add to that in Wisconsin, the folks we've been working with have had some real good luck by just calling the phone number, the help desk.
Great. That's a really helpful thing, Mona. So thank you. That's one of the things that people ask us as the QIO. Well, don't you all have access to the EIDM account so that you can fix these for us? No, we don't. We don't have any access to the EIDM accounts. All we have access to is the guides and the information that CMS provides us with. We have been hearing in the field, at least here in Minnesota, that this process of getting through the EIDM is taking time. So if you haven't been in and gone in and looked, we would strongly encourage you to do so as soon as possible so that you can get this piece resolved, and then you can focus just on your data submission basics.
And just to add to what Candy stated there, you can simply go to that sign-in that we directed to you on the homepage of the QPP.cms.gov and just test out your EIDM user ID and password, log in, at least get familiar with the system, know that those function correctly, and then if they don't, then you've allowed yourself some time and at least done that confirmation. Get that corrected if needs be.
Yeah, and again, I'm mentioning this because Lisa and I were on a call yesterday with somebody who's like, somebody else in IT did our meaningful use, and I did PQRS, and so now people are having to think a little bit differently about how they're going to come together to do this data submission process. So again, just get on if you haven't. Of course, the NPI lookup tool is out there to verify your eligibility, as well as the qualifying APM or QP lookup tool. In the fact sheet for data submission, which is on the CMS.gov website, it states that if there's an inconsistency between the NPI lookup tool and the QP lookup tool, the results of the QP lookup tool will take precedence. So just something to keep in mind as you're looking up NPI and QP as you're doing those lookup tools. And then just a couple of things about group versus individual reporting. You can submit data both as a group and for each individual. So if your individuals fare much better than your group, they can certainly submit their data individually as well, so they will get a higher score. CMS will retain in that portal, in that submission portal, CMS retains all data submitted and uses the higher score. There is no submit or save button in the data submission system. The system automatically updates your record. You can update your data anytime during the submission window. And so to upload your data, that means that you are uploading a QRDA 3 file or
QPP JSON file.
QPP JSON file. So you can do that anytime except for claims. Claims will just be taken from the claims that CMS processes for you in a year. And so we're super pleased at what CMS has done in terms of the submission portal if you haven't gone there. While they don't calculate your aggregate composite score like the MEPS estimator does, it will tell you as you go through each category for each data submission file you're submitting how many points you would earn. So for example, in ACI, in the Advancing Care Information category, you know that you possibly could earn 155 points. And so what the CMS tool will tell you is how many out of the 155 points you would earn for each category for each data file submission. Again, it doesn't do the total composite score, so you'd know what that would be.
One other thing I might add is here, because we just threw out a couple of things that went by very quickly. You heard a couple different file formats that you have that you can upload to the site there. And just to clarify what those are, Candy mentioned the QRDA, Quality Reporting Data Architecture, is that acronym, Category 3, and that is an XML, Extensible Markup Language, if you want to put your technical hat on. So that's one option, and that's something that may come out of your EHR. That's something that your QCDR, if you're working with them, might produce and upload on your behalf. And the other one I mentioned is called a QPP JSON file. And JSON is basically similar to XML. It's kind of a technical language. It's called JavaScript Object Notation. You don't even need to remember that. That's what it stands for, though. But it's just a different file format, and CMS accepts both of those. So your system may produce one or the other.
Right. So, okay, let's keep going. Next slide, please. So these were presented at a different time. We're just leaving them here for just, if you want to consider why should I report as an individual or as a group, here's just some considerations that you can look over and just see, which way do you think you're going to fare better. And again, you might want to know both individual and a group just to know how your score, how you fare better either way. So next slide.
Candy, before I go to the next slide, we do have a question in chat.
Yep.
And the question is, if we are submitting through our EHR, is there anything we need to do on the EIDM submission portal?
Well, it depends on how if your system is producing a file like I described there, then yes, you do. You need to log in and upload that file to the portal. And there's a little pop-up window, and it's kind of typically what we're used to: locate wherever the file exists on your hard drive or network drive, upload it, and then what happens immediately after that is the CMS system kind of does a validation and says, yes, the file format that you uploaded is acceptable, and immediately goes through and scores that, and so you kind of get that affirmation of, yes, what I just uploaded is workable.
I would throw out to the team, though, I think that this will depend. So, first of all, don't make an assumption that if you're reporting via EHR that's all you have to do and that they'll take care of everything for you. So you really need to verify every step of the way along. So I don't think it's highly likely that the EHR vendor is going to have your EIDM roles and accounts, roles and users.
Yeah, unless there is something going on in the background that the vendor is directly submitting to CMS.
Right.
That's the only thing, but you would want, I think as Candy is describing here, to verify that with your EHR vendor, and then also as kind of a sanity check, whether they're doing it or you're doing it for your organization, log into that system because you should have that EIDM, user ID and password, and you can check and validate whether it is done via your vendor, if that's your process, or, of course, if you're doing it, you know that you've gone in and done the upload process. So any sort of backdoor process, whether it's EHR submitting to CMS or QCDR submitting, once they submit that file, you as kind of the owner of that EIDM, user ID and password, can go in and validate and authenticate that your submission has been scored and is properly in the portal.
And that's a super important point because there's many of us, probably a couple in the audience, whose registry or QCDR was supposed to submit a test file and make sure that they had a successful submission of a test file in the old PQRS days in order to assure that you had successfully reported. And I know of at least one organization in which the registry didn't do that. And so the organization didn't know that, and they ended up taking the hit then for this year. So.
And maybe to add on to that, so some organizations are also having that submission because they're part of an APM being done on their behalf, but not realizing that they also need to manually submit for the ACI category. So again, going in and checking to make sure that's done, ask that entity that's working on your behalf, that APM, what is the timing of your submission? When can we expect to see that upload? And then log in and validate that it is there, it's been scored,
right.
and determine if they told you we're doing it all for you, you should see all three categories in there. Some folks will have to independently report that advanced care information. So.
Yeah.
Yes, and this is Lisa jumping in, and I just want to verify, that every EHR, every registry, and every QCDR out there is certified to submit either or quality, advancing care information, and improvement activities. And not every EHR vendor is certified for submitting for you. And if they do submit for you, they have to have an EIDM role and sign up for a role to submit for you, and so you'll need to have some agreements with your EHR vendor. The other caution I would throw out there is that some EHR vendors are just telling clinicians or clinics, don't worry, we'll take care of all of it for you, and what they're aiming for is a neutral payment adjustment, and what you are aiming for may be a little different, so I would really verify, and you can resubmit more than one time. And so, like Candy said before, you can, resubmit in a different method if you're wanting to submit manually some of your own quality measures which come directly out of your EHR.
Yeah, thanks, Lisa. And there's a question from Natasha. Has anyone tried logging in with the EIDM submission portal and received the message your account is locked? We haven't heard that yet, Natasha, but I would definitely call CMS, call that number that was on that previous slide, and find out why your account is locked and get them to unlock that. And if perhaps when we open it up, if someone has experienced that and they took some other action instead of calling CMS, they can share that with the group.
Yeah, and there's one thing Lisa mentioned there that I wanted to add on to, just to call this up, because this is different, especially for those of us that are used to meaningful use attestation. In the old system under, the meaningful use program, you had kind of a submission button that said, I've looked at everything, I've validated, this is it, and I'm clicking on that, and that's what seals the deal. The difference here is in the EIDM and this new portal is up through March 31st, I believe midnight there, you can continue to upload, modify, change, and so once you do that, if you do it this month or in February, you can go back in, make modifications, and so basically what CMS is saying, we're just taking the latest data that we have that has been submitted, and once we close out the system on that date and time, on March 31st midnight, then that's what we're going to take as kind of the final submission. So there isn't a finalized button or this is it.
Right. Nope.
It's more about the date and time. So that's a difference I wanted to draw out between meaningful use attestations and now MIPS.
Okay, and there's a question either for Lisa and Reed, and I don't remember who said this. So can you expand, Joyce is asking, can you expand on the comment you made? If you're submitting as an APM, you still need to submit manually for ACI.
Lisa, I can field that, or you can chime in here. Basically, just confirming with your APM what categories they're submitting on your behalf. There are APMs where you need to submit separately. Lisa, what's your experience been with that?
Your APM, if you're with an advanced APM or an APM, you still need to submit your ACI data.
I think she's asking for a clarification why you said you would need to submit manually for ACI. It's more of a you may need to submit manually for ACI. You just have to verify, that in fact that if you're with an entity that's reporting on your behalf that they're actually able to do that.
Yeah, just kind of clarifying which categories are you submitting for me and which ones am I responsible for. And usually, from my reading and so forth, that is the advancing care information category. If you're asking about the keyword manually there, by that I may have said or meant that you just need to log into the system and do that submission yourself through that upload process. Or if you don't have that JSON or QRDA Category 3 file, you can manually enter that data as you would have under the Meaningful Use Program, kind of a similar process.
Yeah, and that, I think, is the difference that Joyce said, is that it's either that your EHR is doing it for you with a specific file type, or you can just plug your numbers in manually.
So Joyce, if we didn't answer your question, we welcome you to keep asking in just a couple more slides. On this slide, I just wanted to say this should say data submission it should say data submission for 2017 or data submission in 2018. So you're going to report to quality, advancing care information, and improvement activities if you're going for more than a neutral payment adjustment. You can report using different submission methods for each of the categories, but you can only use one submission method per category. The question came up yesterday. Can you submit for different 90-day periods of time? If you're going to submit for 90-day periods of time, can you do different 90-day periods for each of the categories? And I believe the answer is yes, right, everybody? Right, team?
Yep.
Yes, that's correct.
That's correct. And we also had the experience, somebody asked a very similar question about the improvement activity category. We had an FAQ on that, and they may have different date ranges for the different improvement activities that you're doing, but the system only allows one date to be entered at the beginning date and an end date. And so you take what was the earliest date that any improvement activity was commenced on, and what was the final date. That may be the full year for you. It may be some narrowed range, but you can't submit dates for each of those. But that was just another example of how the system is a little bit different and some things we need to pay attention to.
Sure.
And so, Candy, I think if we could maybe get through all the slides. There's some other questions in the chat, but let's get through the slides and then we'll address those questions.
Okay, we just have a couple more slides. You all know this. These are the way that you can do data submission. So that's just a reminder more than anything else. Next slide. Monica, oh, there we go. Just a quick about MIPS scoring. You know you can pick your PACE for 2017. If you chose a test PACE, the minimum that you could do, for example, under claims would be one Medicare patient for one measure for 1 day. You still have until March to submit those claims. Otherwise, you were going to be reporting for 90 days or for 365 days. Next.
Or someplace in between.
Or someplace in between, exactly. Again, here's just a reminder of the scoring. You do nothing, you'll have negative 4% payment adjustment for 2019. 3 points is your neutral payment adjustment. 4 to 69, you can get a positive payment adjustment. And then over 70, you can get a positive payment adjustment plus the exceptional performance bonus payment. So just a quick thing. You know, we've been telling you about the Stratus Health MIPS estimator for a while now. So while the CMS submission portal we're really liking how it's looking. Again, it doesn't give you your total composite score, and if you have claims, you wouldn't know how you would fare via claims for the measures that you chose. So really, and in addition to that, if you enter in your individuals into the MIPS estimator, it will aggregate the score so that you can look to see, am I going to be better off doing group versus individual? It also gives you the different reporting data submission methods that your vendor may not provide for you because a registry may not want you to not choose registry, for example. So it really just gives you an idea of some other choices. And next slide, and then I think we're pretty much wrapping it up. And so you can see then it also then tells you how you're faring in each one of the categories. So just to put a little plug in for that if you're looking, there's just some URLs. The information in these slides was taken out of the 2017 QPP data submission fact sheet. So that's out there on that particular link. And I think that's it, right, Mona? Except for, that's just the resource page. And actually that's an old slide because we don't have the sign-in part on that one. So.
Yeah, so I just put up the last slide of our contact here.
Okay, perfect. So now let's go ahead, if you have questions in chat, also if we want to open up the lines, operator, and we will ask if you do open up your lines, please don't put us on hold because we'll hear your hold music, and also just put yourself on mute if you're not talking so that we don't have too many distractions in the background.
So, Candy, to start with, just the first question that came into chat that we did not address is, in your opinion, and I think this means any of our opinions, is there a benefit other than cost to using the EIDM account versus qualified registry? The only thing that I would say is that sometimes the benchmarks are different. Does anybody have anything else to add?
I think a little bit of confusion on EIDM, or if you were talking about a qualified clinical data registry versus a regular registry versus an EHR. EIDM is that's the access point into the CMS data submission portal itself. So if you will think about that, that's sort of your Outlook address, if you will, in order to for your first login, in order to get into Outlook, for example, you know how you'd have to put in your name and you'd have to have assigned your password and things like that, and you're assigned certain rights in your Outlook. That's what EIDM is. That's how you get into the data submission portal. When you talk about the different report data submission methods, EHR versus registry versus QCDR, it's really very, you'll remember that each of the strategies for data submission, just because there's 243 registry measures that are approved for registry submission, each registry vendor chooses which of those MIPS measures that they are going to support. So they may not support all 243, which may not include the ones you're doing. Same thing applies for EHR. Same thing applies for qualified clinical data registry. Qualified clinical data registry, some of them, many of them have been approved for non-MIPS measures, which they put sort of some unique qualifiers on their measures. So they may submit MIPS measures. They also may support non-MIPS measures. But you have to look on the website, the CMS website, towards the bottom of the resource page. There's a list of the qualified registries as well as the qualified clinical data registries, and it will tell you what it is that CMS approved them for. The other thing is that there may be costs associated with all three data submission methods. So you really, in this next 3 months, we just can't emphasize enough, don't assume anything. Make sure you're asking and articulating your questions so that you're very clearly understanding what it is you're collecting, what it is you're reporting, what the cost might be, and what the benefits might be. Team, have anything else to add?
This is Lisa, and I have one thing to add, and that was great information, Candy. I think you explained it very well. The one thing is that QCDRs, many of the measures that those QCDRs are using are either MIPS measures, so they have benchmarks, or may not have benchmarks, and then the non-MIPS measures that is specific to the target audience they're focusing on. And although some of those non-MIPS measures might have benchmarks, the majority of them right now do not. For 2017, and until right now you will score only 3 points until they get 20 per measure, until they get those at least 20 points for each quality measure uploaded to CMS. And so then CMS is going to apparently deliver on-the-fly benchmarking for QCDR measures, so you won't know what your score is on those measures. So it's a little bit of a gamble.
So, to your question that was in the chat, so there's another use for the Stratus Health MIPS estimator. So you want to make sure, put in your data submission, or, once you put in your the data submission method you think you're going to choose, remember, it's going to tell you what the comparative scores are. So, you have a way to know, well, gosh, I'm going to score much better doing this versus this. So, all right, Mona, I see there is a question that I can see. I think we're seeing different questions. I don't know how that is.
Yeah, I've got another chat question that we have not addressed, and it's, if you are going directly to the CMS website via qpp.cms.gov and manually submit, is that considered the EHR route, or do you have to submit directly from the EHR system for it to be considered EHR method? I do not have a vendor submitting for me. I am doing this on my own for our practice.
Yeah, that's a great question. I have that same question kind of in my own mind when I did the trainer on the data submission portal. So is CMS making an assumption that if you're choosing an EHR method that you're submitting via a certified EHR, and how does that work? I don't know. Team, do you happen to know how that works? I'm not 100% clear on that yet.
Yeah, and I am not either.
I think we'll have to do some follow-up, because my understanding, too, is also there's those bonus points for end-to-end electronic reporting, which touches on this. Is your EHR vendor submitting directly through their agreed EIDM access to CMS? So I'd say let's take that offline and confirm what's going on in the background there.
Yeah, I would agree, because I asked that same question on the trainer. I said, are you making an assumption that because they're doing EIDM, they're doing end-to-end cert? I don't know that. They never answered that question in that trainer training. So we'll take that one offline and do some research on that.
And I see a question here from Patrice Roberts about we don't have the QCDR3 format available to us. The QPP site allows me to manually enter advancing care information and improvement activity measures. Is this all I would have to do for these two categories? For the quality category, would I then need to go with a registry or 4 required providers? our 4 required providers. The last bit there wasn't quite certain on.
So let's start by saying, so if we get it, these acronyms are so confusing for crying out loud. QCDR is Qualified Clinical Data Registry, so that is a data submission method. I think, Patrice, you were referring to the QRDA3 file format. So, now let's go ahead and dice this question.
So she's asking, can she manually enter for advancing care information and improvement activities, and yes, you certainly can. So then to the question of the quality category, would I then need to go with a registry for our 4 required providers? You wouldn't have to go with a registry. You could also manually enter a numerator denominator if you so choose to do that. If you chose to go via a QCDR, again, that's the entity that would do the reporting on the behalf.
Or a registry.
Or QR, Qualified Registry. You would have to do some research, get an agreement with them, and so there's a little legwork. Any comments on that? I mean, there is the benefit of end-to-end electronic reporting that you could get.
Right.
Some bonus points for that.
Yeah. The other thing is, if you are associated with a trade association, many of the trade associations have come forth with their own registry. So I know that they're in varying stages of development, if you will, but that's another option. And I've heard that some of them aren't even charging their trade association members for doing data submission on their behalf. Again, don't make any assumptions in the next 3 months. Make sure you've checked it out very clearly with everybody.
To add to that, maybe what you could do is kind of lay out some different strategies or plans as the lowest common denominator, and certain way of doing that is doing that manual entry in the portal. Make sure you've got your EIDM user ID and password, you've got all 3 category data before you, and then you can manually enter it. Now, if you choose to, for one of the categories, quality, approach a QCDR or QR, quality registry, you could talk, like Candy was saying, through your trade association or whatever, and ask if that's an option. Also, you might want to approach your EHR vendor and ask them, what are you doing? What would the cost be? So you kind of lay out a few different plan A, B, C, and determine what works best for you from a cost, effort, timing, etc. perspective.
Yeah, Patrice brings up a really great point. So I think we might be confusing this point a little bit. It's my understanding that you don't have, so team, correct me if you're understanding it differently. It's my understanding that the only option you have once you go into the portal is to upload a file, not to enter in numerators and denominators. Patrice is saying under quality, the only option I see is to upload a file, no areas for denominator and numerator.
That could be. I may have misspoken on that one, and I apologize. That may be file only. Again, one of our challenges is that we don't have an EIDM and can kind of navigate. We kind of get information that we're pulling through some webinars and so forth. But we'll double check that. I'll do a little follow-up on that one.
Yeah. And this is Lisa. I believe the only way you can upload quality is through a vendor. And they would need to, you would need to work with your vendor to upload quality measures, unless you're doing claims, of course.
But you know what? We're going to get some. We'll get some clarity around that, and in our FAQ document that Mona said, we'll be going out no more than 2 weeks after this call. We'll get some clarification around that, and we'll put that into that FAQ document.
And part of that confirmation, Lisa, I just heard you saying would only be possible through a vendor. I had a little bit different understanding, and I think like the questioner did in the chat section, that your system could produce that file, and then you as an EIDM, a person, and could go in and upload that file, so it wouldn't have to go necessarily through a vendor, but we'll do some confirmation around that.
Yeah.
Yeah. All right, Mona?
Yeah, I don't see any more in the chat, so maybe if we could move to any questions on the line, if we could have the operator remind people of how to ask questions.
Once again, if you have a question, please press star then 1 on your touch-tone phone. And we are on standby for questions.
Yep, and that's okay. We'll just hold on for a couple of minutes here while people think about what they might want to add.
As folks kind of think about their questions in our ongoing series of office hours, it would be helpful, as any of you out there have experience with your submissions, to join us next time and share what sort of experiences you've had, any glitches that you ran into. That's how we all kind of keep our pulse on what's going on out there.
Yeah, and Natasha, this is Candy. I'd love to hear from you once you contacted CMS about why your account is locked. If you could just shoot me an email and just let me know what the response was, because I'm 100% sure you're not going to be the only person that's going to have that issue.
Yeah, we like to function as sort of a clearinghouse for tips and tricks when we do what people have done to resolve these issues.
Absolutely.
And we have a question from Don Wagner. Your line is open.
Hey, Don.
Hi, how are you?
Good. How are you, Don?
Good, thanks. Yeah, this whole process is kind of confusing, so I hope this isn't a redundant question, but here goes. Our intention for our providers is to submit at a group level, entering in their information. Okay, the question I really have is, and then our quality measures, we're going to submit through QRDA. How do I know that the two of them got married up after we've entered our information and that we have provided a full attestation? Is there something online in the portal there that I can go look at that tells me that they matched up my ACI measures to the quality measures that I submitted through QRDA?
Yeah, and I don't know that we have the answer to that today, Don, but we certainly will do a little research on that, but I guess I'll leave it open. Does others in the team have thoughts about that?
One of the things I saw in one of CMS's training videos or webinars on this was that when you log in with your EIDM, user ID, and password, you are presented with the number of TINs or groups that you would be submitting on behalf of.
Right.
And this is kind of an assumption that would need some confirmation. That's why I say, let's get back together and circle the wagons here in a few weeks or a month or whatever it is. But my understanding was once they submitted that information, it gets uploaded to CMS, and then that portal is populated with that data so that you, as a person who also has access, would have visibility to the fact that that quality category has been submitted for your group on your behalf through that different submission method. Again, that's kind of what my takeaway was from what I saw of the attestation or submission portal.
Right, and likewise, Don, if you did multiple quality submissions, for example, again, CMS is going to, it's our understanding that CMS is going to look at, by the time they close down the data submission portal, then they'll look at everything that's in there, and they'll parse out the highest scores from each one of the categories. That's my understanding as well.
Okay, and you're saying we'll see that, which score they chose prior to the 31st?
Oh, will we see which score they chose?
Yeah, we're told this group and then have a high score.
Yeah, see, we're told it's just the highest, but I don't know that. That's a great question.
That's my understanding, too, is you always get the benefit of the doubt getting the highest regardless of which submission methods you've done. So if you did multiple methods, like let's try the EHR, let's do the registry method. Again, what I saw from that webinar, and the commentator there said, we kind of take the highest. You'll see both of those in there, those different submission methods by categories, and then CMS was to take the highest. That was my takeaway. Again, I don't have the final word or say on that, but that was...
And if you want to simplify that process, Don, when you, it would be... So, we are talking a little bit of an extra step here, but by using the MIPS estimator, you're going to see which one is going to fare you better anyway, or you would even submit multiple submission files to CMS.
So one thing we could do, I was just thinking about this, I did this for a question that I was researching. There is a series of recordings out there, and they're available by going to QPP.cms.gov, going to the resource library, and they have a whole section. It's actually under what normally is just the kind of PDF sections. It's not under the webinars, but on submissions. And in the first webinar, they have, I think it's at like minute 5 to 7 or something like that, they actually show different methods of submitting and is showing the score and so forth. So we could do a little confirmation. I'm not sure how we want to distribute that, Candy or Lisa, but I think I can do some legwork, and that may answer, Dawn, your question there.
Okay, thanks. I appreciate it.
All right, great. So there was a question in chat about improvement activities. Is it, just a second, I just have to lower this a second. Okay, with regards to improvement activities, this is from Peter Tree. Is it correct that a single clinician could perform the required activity on behalf of an entire large group, so that the work of one counts for the work of the group for a TIN that, for example, has 200 clinicians? The answer to that is yes. That is, you are correct as long as you're doing group reporting. Team, anybody have anything else to add?
No, and I put that answer in the chat as well, Candy.
Okay, I can't see. I'm only seeing partial chat, so.
I think it might be delayed or something. I'm not sure. And then now we have another question in chat. How are ACI? Can a single clinician do that as well? So kind of a similar question, if you have one clinician in your group that completes all that can get the ACI base measures, does everyone get that score? My understanding is it's a group report, yes, because you need at least one in the numerators there.
That's my understanding as well.
Yes, I agree. That's Lisa. You can have one from your group who meets the summary of care requirement, for example, and your group will get the credit. But if you report individually, only the ones who are getting that summary of care 1 or whatever it is will get the score for ACI because that's a mandatory score. The only exception and the new exception for 2018 that goes back to 2017 is if you have less than 100 transitions of care. And if you're reporting individually, that's 100 per individual, and if you're reporting as a group, it's 100 per group. And that exclusion applies to both e-prescribing and to transitions of care, summary of care.
All right. Operator, do we have any other questions in queue?
We have no further audio questions at this time.
Okay. Mona, are you seeing any other chat questions at the moment?
I don't see anything in chat.
Okay. So we'll hang out for a couple more minutes. You might want to just forward the slide just as long as we're just waiting. Go to the next slide so we're showing our next office hour date. So we will be having a similar office hours a couple of things. There's 3 poll questions on the far right-hand side that are in chat. If you could just please go ahead and answer those questions. We would really appreciate it. I guess I would like to hear personally, we chose to provide about 15 minutes of didactic lecture just because this is also new to everybody. Would your preference be to have us repeat that with whatever it is new that we know about data submission in the next couple of months so that you're repeating what you're hearing? But then we also have office hours on February 15th and then on March 15th as well, which will just get us squeezed in just before the March 16th CMS web interface deadline. So we just want to invite you to those as well. And just wait a couple more minutes just to see if there's any other follow-up questions. And I think Reed's looking something up to reference before we leave. Is that what you're doing?
Yeah, I'm going to try and put in a link here.
Okay, so
to where the data submission fact sheet.
Oh, yes.
Series of webinars are.
Okay, it's the fact sheet. Whoops. If you go back to that site.
Well, I'm going to put in a link. They'll have to scroll down.
Oh, I see. Oh, I thought you were going to just do that. Okay. Yes, got it. So Reed's just put the link up that takes you directly to, can you repeat?
So that's the CMS resource library. And basically what this is 2017 resources. and you'll need to scroll down to Find Resource by Topic 2017.
Yep.
And you'll see in bold a data submission header, and there's a link for a PDF data submission fact sheet, and below that are a series of 3 videos, and that's what I was referring to for Don Wagner's question.
Sure.
The first one there, Merit-Based Incentive Payment System data submission, and then there's an ACI, and then there's a QCDR. But they kind of took a webinar and broke it out into 3 pieces.
Sure.
That's a YouTube link there.
And then just above the data submission, you'll see the EIDM user guide, both just regular user guide and then for user guide. I saw another question in chat, so let's go back. Can you repeat what is due on 1/22/18? Sorry, but we might have misspoken, but there's
starting of the web interface submission.
Oh, that's what begins. I see. Yeah. Thank you, Rita.
Yeah, so that's when, if you're doing web interface with a group of 25 or more, that submission method, that's when CMS opens that submission window.
So for the rest of the data submission methods, other than CMS web interface, that the portal opened up as of 1/2/18 for data submission to begin. But if you, as Reed said, if you're a group of 25 or more and you are reporting as a CMS web interface, which all of the APMs are, I believe, in all of the states, at least it is true for sure for Minnesota, that one does not open up until 1/22/18.
And closes March 16th.
And closes March 16th at 8 p.m. Eastern Standard Time.
There was one other question, and it actually got put into the Q&A, so I just came across it, about participation in a PCMH and whether that you get full credit in the improvement activity for your participation, and that the answer is yes if you are a certified or recognized PCMH. Yep.
Yeah, and we'll just say one other thing about that. Yes, you get full credit, and the submission portal somehow recognizes you for being a patient-centered medical home. But the other thing is if you are looking to receive bonus points in the ACI category, you'll recall that for 2017 there are 18 improvement activities that if you are using CERT to attest to those activities, you are eligible for bonus points. So if, in fact, you are a patient-centered medical home or deemed status as we are in Minnesota here, if you're looking to get those bonus points in the ACI category, you will have to put in at least one of those 18 improvement activities that have been approved for the bonus points.
And that does change in 2018.
It
that
does.
PCMH rule for the improvement activity category. I think it was that 50%. Candy or Lisa, do you know the deal with that? Where we currently have one. If you have one location that's certified as a PCMH or healthcare home in Minnesota, then all of those organizations under that 10 entities would get credit for that. So all eligible clinicians. But that was changing to, I believe, was it 50% in 2018 would have to be PCMH or healthcare home certified?
I think you're right.
That was one of the nuances of,
But
don't worry about it for
we'll keep going.
It's something that's changing.
And there's a question, hi Lois, will you start sharing information about the cost category that will start in 2018? So yes, we will. Here's what our thinking is for the most part, and I'll just talk briefly about cost in just a second here. We really want to get people successfully through the data submission period in March of 2017. So beginning, April 1st of 2018, we will be, counting down the information about the 2018 final rule. We've been scouring through it, but again, we don't want to confuse 2017 with 2018. But so yes, we will. With regards to the cost category for 2018, it becomes 10% of your score in 2018. And where the proposed rule, there were 10 episodic-based measures that would have comprised the cost category. They, in their final rule, have reduced that to 2 measures, and the 2 measures that will contribute to your cost score of 10% for 2018 are Medicare spending per beneficiary and total per capita cost. And those are for Medicare beneficiaries that are attributed to you. So more to come about the attribution process, and how that all will work. But we'll continue to we'll continue to provide information as we go on. Another question about 2018, is 2018 reporting period 365 days or 90 days? That's a great question. For cost and quality, correct? It is 365 days.
Yes, that's correct.
Yep, because I know I mix these up from time to time. And for ACI and improvement activities, you could choose 90 days or 365 days or somewhere in between that period of time. So what that really means for you in terms of quality, you're really going to want to hit the ground running for 2018 with your workflows and so on, so that you can get a solid year under your belt for quality, having practiced in 2017. Any other questions in the audio operator, Jenny?
No questions at this time.
Back to that cost thing, since we have a moment here, and please, anybody, if you have other questions that relate to 2017, interject, because we're thinking ahead a little bit, is my understanding was CMS was going to produce those QR/UR reports for 2017 so that you could take a look at those cost measures and kind of anticipate how do we do in the prior year, and what does that mean for 2018 when that will count towards 10% of our performance score.
And that's another thing that we'll be building out based on our best assumptions about what the cost category will look like. We'll be working on building that out in the MIPS estimator so that you'd have some idea based on past performance or your QR/UR data or whatever, how your cost category might look for 2018. Again, it's it's only 10%, which we're happy about because it's going up to 30% in 2019. So, it kind of, again, gives us a year to practice, if you will, with cost.
And that's just an FYI, where did that 10% come from overall? Well, it was carved out of the quality category, so that goes down from 60 for 2017, goes down to 50%.
Right.
And then we'll see that additional, 30% for the cost category in 2019. Where does it come from? I think the majority, again, comes from the quality category.
Yeah. So, all right. Anything else? Mona, you're seeing any other questions that I'm missing?
Yeah, I am not, and I think we're pretty much at time.
Yeah, we are. Boy, this was an awesome discussion. Really good, rich stuff. So we thank you for joining us today, and we look forward to seeing you in February. Thanks, everybody.
Thank you. Bye.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.